And you are
What do I say?
All right.
live.
So tell us about what you're doing here.
Hey guys, so today we're actually doing another radio frequency treatment on a patient who's post-op. And we are basically heating up the tissue slowly using a venous legacy device. And what this does is it actually heats up the tissue and causes the skin to tighten. And it can actually be used for a little bit of subcutaneous fat loss. So what I'm doing right now is I'm moving the handle pretty quickly because we don't want to stay in one area for too long. Essentially, it equally heats up the tissue to our desired temperature.
Can you tell us one more time for the people that just tune in what you're doing?
Yeah, so we're doing a treatment called venous legacy. It's an radio frequency device that's going to help heat up the tissue. And what that does is at particular temperatures, it actually tightens skin. So also, if the patient desires to do this treatment to kind of have some fat loss, we can do it with subcutaneous fat. It does heat up the tissue to a temperature where fat would essentially melt and your body would get rid of it and essentially pee it out. So right now, we're doing it on a post-op patient. He had high definition liposculpture done by Dr. Emer, and he just is doing this to help tighten that skin that we did procedure on and have a more refined look. I mean, he's already sculpted. You can already see here, if you guys come in, you can actually already see his definition here. And what we're doing is we're just adding more to that.
Does this work with patients that have tummy tucks and have so-called dog ears?
Yes, it's actually good for even patients who are not post-op patients. People who are not surgical patients can still benefit from this treatment, because what it's going to do is it's going to tighten skin in areas that, like the abdomen, a lot of patients want. Now, this is not a weight loss procedure. This is simply just skin tightening. Now, at certain temperatures, it will get rid of some of the subcutaneous fat, which is fat that's closer to the skin, but the fat that's associated with deeper layers, that's not what we're targeting here.
And how does it do that? How does it tighten the skin?
So it tightens the skin because as we stimulate with heat, we have a new growth of collagen, and the skin just naturally will tighten with heat and actually contract a little bit to cause that tightening look that everybody wants, especially on the abdomen. So after surgery, this is good. It also helps the lymphatic system work, get rid of any excess fluids, and overall just helps reduce the downtime after surgery and optimize results.
Can you tell us a little bit about the tip that you're using?
Yeah, so this tip is called an Octipolar tip, and it basically has all these little heads on it, which are going to cause the skin tissue to heat up slowly. So again, the reason I'm moving it so quickly, sorry it's too fast for the camera guys, but I'm moving it quickly so it doesn't stay in one place for too long, because if it does, it'll heat up pretty quick.
And what happens if it heats up really quick?
Well, we don't want to, it has to be done by someone who's trained, because if it's done improperly, like if you stay in one area too long, it can actually burn the skin. So that's why we watch the temperature. We definitely want to make sure we're getting to the level we want.
Now, for those that have dog ears and then need to take care of the dog ears, the so-called dog ears after a tummy tuck, how many treatments would you say they need?
It really depends, but we ideally like to tell patients to get started with 3 or 4 treatments, and then from there you can do it as a maintenance. So it really depends. You can definitely book a consultation and see, but not a lot of doctors emphasize post-care, you guys. It's really important. Dr. Emer stresses it. We really encourage our patients to take advantage of all the technology that we have here, because it's going to help optimize results, reduce healing time, and just give optimal look.
And then how is this different from True Sculpt or Sculpture?
So True Sculpt, we have True Sculpt ID, we have Flex. What that's going to do is that's targeting more of skin tightening with the fat loss, and then the Flex is going to be for toning. So those are all good options. We actually encourage a combination of treatments. You can actually use all 3 if you're not a post-op patient, or 2. You could do the Flex and the venous legacy. So with the skin tightening, you can also get the abdominal muscles to kind of build more with the Flex.
Andre's asking if it tingles.
Does not tingle. How do you feel?
Feels pretty good actually.
Pretty good. It kind of feels like a little bit of a massage, kind of like a stone massage, I guess, a stone massage, you could call it.
And then it's throwing radio frequency energy through those little.
Exactly. So what we're doing is we're sending those waves of energy into the tissue, causing it to naturally heat up. And when we get to our desired temperature, we can move on to the next section. But we want to equally treat all the areas and get that tightening in the concentrated area that we're working on. So today we're doing the abdomen, but look, you could do it for the legs, the thighs, you could do it to the arms.
Is this one of those treatments that takes 6 months to see results?
It is a treatment that takes an additive effect. So you're not going to see results just from one treatment, but you're definitely going to start seeing a lot of skin tightening. It does take time for your body to metabolize and tighten. So it is something you'll see over the course of about 4 to 6 months.
For those that just tuned in, this is a skin tightening treatment. Tell us what it is one more time.
Yes, a radio frequency device. It's called Venus Legacy. And what we're doing is we're using this device to heat up the tissue to tighten the skin. So I'm moving quickly because it is targeting wherever it's on. So I'm moving it quickly so it can equally heat up the tissue in all areas that we're targeting today. And we're doing the abdomen on our post-op patient with high definition lipo.
All right, that's it.
All right, you guys. Well, listen, make a consultation. You guys can get this or any other procedure. We can talk about what would benefit you.